Hello, colleague. This is Maryam Alkhatry, consultant gastroenterologist and hepatologist, advanced endoscopist, head of endoscopy department at Barham bin Hamad Al Baydallah, Emirates Health Services, United Arab Emirates.
Hello, my name is Barham Dayyeh. I'm professor of medicine and the director of advanced endoscopy at the Mayo Clinic in Rochester, Minnesota. It's our pleasure to introduce to you the study that we've done together in collaboration with between EHS and Mayo Clinic between myself and Dr. Alkhatry, and Dr. Alkhatry will introduce the title of the study.
The title of our article is Improvement in Hepatic Steatosis, Obesity, and Insulin Resistance in Adults with Non-Alcoholic Fatty Liver Disease after Post-2 Procedure or Primary Obesity Surgery Endoluminal 2.0 Procedure.
Dr. Alkhatry, this is a novel study with some important findings. Could you, before we start discussing the study, tell us why did you do this study, especially in the United Arab Emirates?
Obesity is an escalating global public health issue affecting individuals of all ages and background. And as you know all, United Arab Emirates has a rapid economic growth. And we found that there is significant rise in obesity rate in recent years. Therefore, as a result of that, we found there is high burden of non-alcoholic fatty liver disease in our region, and we don't have therapeutic available or effective therapeutic for this disease. We were investigating this novel procedure to evaluate the efficacy and safety of this procedure for non-alcoholic fatty liver disease patients.
Fantastic. Thank you, Dr. Alkhatry, for conducting such an important study.
Dr. Abu Dayyeh, since you carried this study with our center, could you please comment on the outcome of the study and why you think it's important?
Yeah, it's a very interesting and novel study design where 42 individuals were allocated to either undergoing this novel endoscopic procedure called post 2.0 versus moderate intensity lifestyle modification, or actually high intensity lifestyle modification. Patients were offered both options, and they chose the option that they felt that they could follow and they could be successful with. Interestingly, the group that got allocated prospectively to the post 2.0 had significant improvement in measures of steatosis as measured by a fibroscan and the controlled attenuation parameters. Indeed, more than 50% of those subjected to the novel procedure had resolution of their steatosis versus none in the control arm had resolution of their steatosis. Weight loss was also very significantly different between the two groups. The post 2.0 arm achieved about 17.6 total body weight loss versus the lifestyle arm achieving 4.5% total body weight loss at 1 year. So the results are extremely clinically valuable because now we have a tool that could help fatty liver disease in a significant number of patients and should be used to as a treatment modality for the management of NAFLD. So, Dr. Alkhatry, now that we had a synopsis of the results of the study, could you tell us what's the next steps here in your research program, advancing the novel therapeutics for NAFLD and the treatment and the field of endobariatrics?
Great question. I think I will highlight important points. First of all, clinical implementation of endobariatric is very important and have proved to be effective for weight loss. Also, endobariatric and metabolic therapies address management gap in patients with obesity who have not responded to the conservative medical intervention and they are unwilling to go for bariatric procedure. Therefore, during our new studies, we are looking to combine both the pharmacotherapist with endobariatric procedure in order to augment both the magnitude of the weight loss and the durability of the weight loss while maintaining the safety that's provided by endobariatric procedure.
Fantastic. I think that is very forward thinking, and as any chronic disease, combination management of the disease is going to be a treatment paradigm for sure.
Thank you so much. It was a great collaboration. I will leave the conclusion for this study to you, Dr. Abu Dayyeh.
Well, as gastroenterologists, we know that metabolic disease affects the GI tract, and fatty liver disease has significant burden on patient health and the healthcare system. So having effective tools for the management of NAFLD are important. And here we showed that endoscopy, such as utilizing the post 2.0 procedure, could be effectively utilized. Therefore, that's welcome addition to the literature, and more studies need to come, but the future is bright in this regard. So thank you for conducting the
Thank you
study and
so
the
much.
collaboration.
Thank you.